So hello everyone, I have a wonderful patient. She's officially being discharged at 5.5 weeks. Now let me ask you this, what led you to the explant?
Well, I started getting a lot of symptoms. I started doing a lot of research and just knew that I needed to get these toxic things out of me. I also did have a rupture, so that kind of pushed the process forward.
You fast forwarded the process, right?
Yes.
Now let me ask you this, when did you get your implants?
2010.
2000, so these were in itself 15 years old, they needed to be removed. Now you were watching me from a distance, from far away for quite some time, correct?
I've been a member of your Facebook group for a couple of years.
Yes. Now what made you, obviously you had the rupture that kind of was a catalyst for you to come in. What prompted you otherwise? What are the other factors that were going through your mind as you chose to explant? Well, you could have very much so, had you gone to any plastic surgeon in the US and not said a word, they would all have suggested, we'll take these Saline implants out, the right one ruptured, and they would have put in a silicone implant in a heartbeat.
Yep.
Now, let me ask you this, why did you choose to get an explant?
Because I started doing my research and I knew that they should never been put in the first place, and I just wanted them out. I knew you would take everything out, the capsule out. I knew you would video the procedure and, you know, promise that you got everything. So that's why I went with you. I actually sent my mom to you. You explanted my mom a couple of years ago, and her surgery went beautifully and recovery went great. So I knew I was in great hands.
Sure. As you can see, your entire pathology was tested, and you have the peace of mind. There's no surprises awaiting you. Your cultures were done. Your exam looks remarkable, very nice, excellent. Now, let me ask you this. Clearly, you did not need drains. Do you think at 6 weeks, you're 52, at 5.5 weeks, do you think you needed a lift?
No.
And you had 400 cc, very reasonable sized implants for your chest width, and you clearly, I will tell you, you did not need a lift. I have to say, your surgeon who did your surgery did a wonderful job, because he made my job easy. And so that really helps. Believe it or not, I had on the same seat, my first patient today was 78, and she did not need a lift. And so this is basically goes to showing you that a lift is not always required. Now, did you ever second guess yourself in regards to getting an explant or no?
No, I'd been doing the research for several years and knew I wanted them out, and I knew that you were the right doctor for it.
Thank you. The take-home message is, do your homework. You did the research a couple of years. After some time, initially you're overwhelmed, but after some time, the same theme recurs itself, that the capsule must be removed along with the implant. Now, what symptoms have you improved upon post-op?
I think my joint pain is better. I think I'm less tired. Dry skin is better. Headaches are better.
Now remember, it takes some time for you to get here, meaning as far as, you know, wanting an explant with the many symptoms of what are suggestive of what is breast implant illness. A year and a half out, you know, if we were to do the interview, that will be the real one, so we can compare the before and after. And I will tell you, your personality has come out. You're definitely more lively. I do not know, your friends, your family will notice that. But as you will see, you have that utmost peace of mind that all of the capsular was removed, all of it was tested, and you have no surprises awaiting you. Now, thanks for sharing your journey. What would you say, one last question, to those who are sitting on the fence, not sure if this is going to help them?
Definitely come see Dr. Khan for the consult, because he will put your mind at ease and you are doing the right thing.
Yes, no, thank you. And follow the Facebook, listen to the other ladies. I tell everyone, do not listen to me, listen to the ladies. You yourself made the decision. You had, you know, your family member, your mom, you know, that was a big test, if you will, quote unquote. I've had 5 ladies that came, they all got implants. They said to one of their best friends who was the most willing, usually the older one, said, you get the explant, let's see what happens to you. And then they saw the benefit, right? And so this is by word of mouth, but the local patients, and in this case we had an international patient from Scotland today. They are able to put the 2 and 2 together and reach this decision with peace of mind that this is what needs to be done. Now, thanks for sharing your journey. God bless you. And you know, very important details in this testimony that you have. Thank you.
Thank you.